Good afternoon. My name is Isabel Brodie, and I'm presenting to you this afternoon the findings from a scoping review of the literature relating to the participation of young people. This scoping review has taken place as part of the participation strand of the Alexi project, and that is an evaluation that is taking place within the International Centre at the University of Bedfordshire. A commitment to listening to and understanding the views of young people is part of the mission of the International Centre, which more generally aims to increase understanding of and improve responses to child sexual exploitation, violence and trafficking in local, national and international contexts. And our perspective is that it is only through the meaningful and ethical engagement of children and young people that we actually will understand and be able to improve responses to CSE and other forms of sexual violence and trafficking. And that where these voices are absent, our understanding is at best impaired, and at worst that we simply do not understand what is going on in relation to their experiences. And the Alexi project reflects very much that thinking. And the Alexi project is funded by CIFA, which is the Child Sexual Exploitation Funders Alliance. And the intention of the CIFA Hub and Spoke project is to establish CSE specialist services that are linked to existing hub services in a wider range of geographical locations. The task of the evaluation is to understand better how these services work in particular contexts, the mechanisms for change and improvement, and the outcomes for services and for young people. Within this, participation has a specific strand, and that reflects the importance that is attached to young people's views and experiences within the CIFA strategy overall. So the aims of the participation strand are on the slide that you can see. First of all, how hub and spoke services view and conceptualise participation. Do they agree what that means? How far is it contested, or is there disagreement about these definitions? Secondly, what are hub and spoke services doing to actively engage young people in informing and shaping the services that are provided? It's very easy to talk the talk of participation, but it is also important to get some hard evidence about the activities that are actually taking place and the practice that through which participation is embedded. Are there, thirdly, examples of good practice and working that seems to be effective? Overall, we need more evidence about this, and so we're keen to collect information about where things seem to be working well. But participation is not an easy area of practice, and it is also important that we understand what's challenging about young people's participation in CSE services and how that's addressed, how these issues are managed. And finally, the Alexi project generally is committed to improvement. The evaluation aims to provide services with emerging research information, and similarly, learning about participation is being shared and disseminated, and we're looking for new and effective ways of doing that. And indeed, this presentation is part of these efforts. So what are we doing within the participation strand to achieve these aims? Well, first of all, and a significant part of the first stage of the participation strand has been a scoping review of the literature and a practitioner summary of that, which we're currently disseminating. And again, this presentation is part of that process. Secondly, we are talking to young people. We are finding ways to gather their ideas about how they can best be involved in services, how they want to participate, the approaches they think work and those that don't, and that will result in some form of young people's output that explains their views about participation. We're also gathering information about practice through interviews of managers and other staff. And we're also responding to issues that those in services think are important and we think are worth pursuing to promote understanding of how participation works. And one of the issues that has emerged to date is around the opportunities and challenges associated with group work in CSE services, and we're in the process of undertaking a mini project relating to that. So, moving on to the scoping review, which is the main issue that we're addressing in this presentation. And you may ask, why a scoping review? Why do we need that kind of very research and desk-based process to better understand participation in CSE services? Well, it's certainly true that participation is widely viewed as important in thinking and debate and discussion around CSE practice. It has been very clear from public inquiries and in other fora that young people need to be listened to if we're going to be able to understand and respond to the very serious nature of the abuse that they have experienced or are at risk of. So we already know that it's viewed as important, but there has been a lack of testing of these assumptions of the importance of participation against wider evidence in the field. It is a fact that's well established and quickly becomes apparent in practice discussions that there are many different ways in which participation is defined and practiced. And a scoping review provides an opportunity to explore that in relation to a wider body of evidence about participation in services as these are delivered to children and young people more generally. So the review provides a bedrock of evidence through which we can understand and evaluate the other kinds of information we're gathering in the participation strand and also in the Alexi project more generally. That said, there is an issue about the kind of knowledge that a review focuses on. Within this review, the emphasis has been on peer-reviewed, published research information. It has not examined the many and fascinating resources that services have developed to support their participative practice. And one might argue that such a research-focused review doesn't really fit with the spirit of participatory practice, which is very much about doing. It very much is about the experiences, the views, the enacting of participation by young people who receive CSE and other services. So it is undoubtedly limited. It provides a certain view of the world. It reflects only that knowledge that about participation that has been collected, that has been presented in very academic journals and other forms of dissemination. And we need to bear that limitation in mind while recognising that that kind of knowledge also has a place in understanding the nature of participation in services for children and young people today. So how was the scoping review undertaken, and what is a scoping review? Is it different or similar to other kinds of literature reviews? Well, it's a scoping review in the sense that it's a broad overview of the field, identifying key and significant information, rather than a systematic review which involves a very tight and systematic process of evaluating the evidence. We already know from other work that's been done on CSE, including other reviews within the International Centre, that the quality of evidence and the quantity of evidence about participation means that it's difficult to apply the very strict criteria for a systematic review. And this seems to be more helpful to undertake a scoping review in underpinning the other work that we're undertaking. Broadly, however, it follows a very similar process. And in relation to the process of undertaking this review, you can see a diagram there, starting off by identifying research questions, but then developing inclusion and exclusion criteria which help us to select the literature. It's very important in all kinds of review that we place boundaries around it, otherwise there really would be no end to the articles and other materials that could be read. So in terms of our criteria, you can read more about that in the main review, but we looked at literature that was after 1989, and the reason for that was that, as you will know, is the date of the Children Act 1989 in the UK, which embedded the idea of child-focused practice, listening to children about decisions concerning them and consulting them. We also decided to focus on the UK only, and that one of the reasons for that was that we are interested in participation in the context of CSE services, and we know there has been a particular trajectory of development around CSE and also around participation. But there would, of course, be huge value in looking further afield and undertaking a more internationally focused review in this area. Following that, the next process is about searching and screening the literature, so actually identifying what's relevant, and that happens through searches of academic databases and searching of what we call grey literature that's produced by relevant organisations and government departments, so different kinds of reports. And we then ended up with a fairly large sample of material. It's worth noting, though, that we only found 7 what we've called core studies, which looked specifically at the experiences of young people within CSE services. And while these in themselves were not enough to help us answer the research questions, or at least it would have been a very short review if that had been the case, we were therefore dealing with a broader sample as well, which helped us understand participation more broadly. So that process has helped us make some comment on the overall shape of the evidence relating to participation and the experiences of young people in CSE services. We know that CSE has been a very rapidly developing area of research, and there are many more studies than there were, so it can be considered a developing area. There are still many gaps, both in terms of the methods that are being used, the kinds of samples that are being identified. But I think it is fair to say we're now in a position to identify areas of strength and weakness in the literature that's available and in the evidence base. We know that there is a very strong and important research policy and practice relationship in the area of CSE, and there are important links to be made there with experiences of participation. By thinking about this in research terms, there is a great deal of potential to feed further into policy and practice agendas. We also know that while participation is almost assumed to be important in CSE practice, increasingly within research and practice debate, we are thinking more critically about what that might mean and how that does relate to wide policy agendas. So it has been hugely important to actually highlight the existence of and the scale of child sexual exploitation in the UK over recent years. Increasingly, we're asking questions about whether we should only be presenting young people who've experienced CSE as victims and what that does to them and their identity and their experiences. We also are asking more questions about different groups of young people who experience CSE and the extent to which their voices are being heard in current debates. At the same time, participation within the literature has often been recognised as something that seems appealing, that seems positive, something we think is important to have. There is a danger that because we recognise the importance of the issue, we haven't always asked critical questions or looked beyond and compared the experience in CSE services with experiences elsewhere. And it's important, therefore, that research plays an active role in undertaking the critique and broadening these horizons. And there are certainly gaps in terms of the participative experiences of young people who've received CSE services. And these, some of these are listed there, and they include young people who've received CSE services but are those who are less willing or reluctant or for whatever reason don't wish to take part in formalised participation experiences. So those who don't join groups, who don't want to come and present at conferences, who don't want to make films, but who have still received services and whose voices still need to be heard. We also don't know a huge amount about the experiences and views of professionals working in CSE services, what that's like, what it's like working with a caseload, what it's like trying to take young people's views into account or providing opportunities for them to influence service design or wider policy. And we also know that similarly we have relatively little experience of the views of specific groups of young people. Often mentioned are those from young people from different minority ethnic groups, disabled young people of different sexualities, young people who have other service experiences, who may be homeless, who may be older, or whatever else. There's a question mark there about how far services are reaching diverse range of groups, and that may help explain why, consequently, we don't always have as much evidence as we would like. And another important area where we lack information is about participation itself. We may have activities reported, good practice may be showcased, and that is all very important. But at the same time, it is hard to measure and assess progress and participation in organisations. That's been found elsewhere in social care and health. But we certainly need evidence to help services design, monitor, evaluate how participation sits and develops in their organisations. And in understanding all of this, it's also important to make some reference to the wider policy context. As I've already discussed, we have been working in a context where CSE has come to public attention, often very dramatically. Over the last 15 to 20 years, we've seen the development of very different policies, new guidance, new thinking about CSE. But we also have to bear in mind where this comes from, and we can trace that back to policy relating to young people who were viewed as being involved in child prostitution. And into the early 2000s, that was the language that we were using. And in that context, young people who were being sexually exploited were subject to criminalisation, who were not viewed as children, were not viewed as being in need of a welfare response. And that really only shifted in the early 2000s with new research and new thinking amongst policymakers that recognised that a welfare response was required, that these were young people, children, defined as such in law and needed to be helped rather than punished. So that has been a big shift, but at the same time, some ideas, some of that thinking can still permeate the way in which we respond to young people. That has been accompanied, however, by very dramatic public exposure of CSE, perhaps most dramatically in the case of Rotherham, as reported through the J inquiry. But there have been many other cases which have highlighted the very damaging responses that young people have received, the ways in which they have been ignored, the ways in which they have been subject to chronic sexual exploitation, and the very harmful results of that in their lives. That has drawn attention to the need to take young people seriously, to listen to them, to recognise that the CSE is something that really happens. And this is reflected in official guidance, which is very clear that professionals need to build relationships. They have to be in a position and have relationships with young people where young people feel able to tell them what's happening to them, feel safe, and that professionals take seriously and respond to what young people say, that there is action rather than a passive listening and acceptance of the status quo. That's at the level of individual professional relationships, but official guidance also has also stressed the need for the strategic involvement of young people in local policy and practice. And it's therefore rather disappointing that that a recent report from the Office of the Children's Commissioner found that only 31% of local safeguarding boards with a CSE strategy have involved young people in the design of this. And that would indicate that LSCBs still struggle with how that can happen and the mechanisms through which young people can take part in that level of service design. So there are many positives about the policy context in the sense that this has a much higher profile and is taken much more seriously. But at the same time, CSE policy can't be detached from a wider policy context. And as you and most of those listening will be aware, we're working in a context of economic austerity where significant cuts have been made to public services. Young people who receive CSE services are also children who go to school, young people who may be in care, young people who may be experiencing difficulties with substance abuse or mental health, and it's therefore important that all services are listening to children and finding ways of participating, and also that CSE services have the resources that they need in order to provide spaces for young people to be listened to and responded to. And that is by no means easy in the service context in which they are working. So when we look at why participation has been important, we're bearing that context in mind. And it's very clear that we need to hold on to the important value of participation in a challenging context, and to remember that many of the young people who are coming to CSE services have not been listened to and have been treated badly by other services who may have ignored or rejected their accounts of what has happened to them. CSE has, in a way, been fortunate as an issue in that its emergence in the late 90s, early 2000s means that it has been able to build on a decade of policy research and practice thinking about participation in other service contexts. Participation in itself is not a new idea, and huge amounts of work have been done in respect to other services to try and support participation. And there is a great deal of literature and resource relating to children and young people in care, disabled children and young people receiving different kinds of medical treatment, for example. And participation is also something that has been embedded in other structural developments, such as the appointment of children's commissioners in the four nations of the UK, who do monitor participation and are looking to see how this is being carried out, very much in line with what we're trying to do in this project. But when we look at the literature on participation, we do find that it's less easy to pin down than we might wish. And the slide that you can see there just lists some of the terms that one will find when you start to search and read about participation. And there are questions to be asked. Do they all mean the same thing? Do they mean different things? Is consultation the same as participation? Increasingly, we use terms such as co-production of services or the co-creation of services. These are very much in tune with ideas and values relating to participation, but mean something, I think, slightly different in terms of young people's experience of services. So these differences in definition are important, but it is worth considering and thinking about what you mean in terms of participation, and how that affects your approach to practice. In the same way that there are many terms that are used in relation to participation, there are also many different models that have emerged around participation, and it's worth thinking about some of these. We have heard much about participation ladders as developed by Shear and Hart. Sometimes you may hear people talking about pyramids of participation, circles or zones of participation. And these say something about the way in which we think about participation. The idea of ladders or pyramids has sometimes been criticised because it implies different levels of participation and even a hierarchy of participation. There are also certain images of participation that are not insignificant in our thinking. So the colourful pictures you see on the slide there say something about the positive way in which participation is viewed. In the circles and the hands, there's a sense of sharing, of equality, of something that's happy and good. These images are great, but it's important they don't detract from the challenges relating to participation and the fact that participation will mean challenging existing structures and approaches to practice. So when we look at participation as a concept, we find that in the literature there are different strands which achieve different things in terms of our understanding of participation. So we find literature that focuses on the development of participation as an idea. What does it mean? Has that changed over time? How is that reflected in the thinking of organisations like the UN, government, individual services? Then we have literature that looks at participation in the context of the delivery of services. How does it actually happen? How is it translated from policy into practice? And then we have a small body of literature that examines participation in the context of CSE services. even then, it's not always very explicit, and often the number of young people involved may be actually quite small in the studies concerned. But in reading the literature around participation and the ideas associated with it, it's very quickly apparent that the key issue in understanding participation and understanding uh, why it happens, why it doesn't happen, is the significance of power dynamics in shaping participation and the participatory experience. The extent to which young people, the extent to which any group has a voice, the extent to which that is listened to, and the extent to which that can effect change is fundamentally affected by the power relationships between these individuals and other individuals within the organisation and beyond. So participation is therefore likely to be a sensitive topic. Those who are not listened to, who are marginalised, will find it difficult to break into arenas where power is held by groups who may have no interest in or who may be affected negatively by the participation of the more marginalised group. So it's not going to be an easy area, it's not always going to be fun, and there will be challenges along the way. This brings us, though, to a particular issue within the CSE literature, where the idea of listening to children and young people and taking them seriously and providing opportunities for participation is often taken for granted. It may be assumed as something that's necessary. And in understanding this, it's worth considering what young people themselves say in the literature about participation. And ironically, it's not a word that tends to be used in their accounts about their experiences of services. Now, it is worth saying that the number of studies here is small, the samples are small, the young people who are interviewed tend to be those who have experienced more participation in services than many others who will have received these same services. So that in a way highlights the issue still further. They are not concerned about participation per se. What they are interested in is the quality of the service they receive, and even more the relationships that exist within that service. They value the fact that engagement in CSE services is voluntary, and in this respect there are close parallels with youth work and the way in which youth work services are delivered. They value the emphasis placed within services on building relationships, the fact that workers in CSE services persevere in these relationships, that they reach out, that they don't let them go even when things are particularly challenging. Young people recognise that their behaviour will often have been very difficult, and they consequently really appreciate the efforts and the extra mile, as they often refer to it, that workers have gone to. And within these relationships, the fact that they have been listened to is recognised. They've had the opportunity to express their points of view. There has been time to do that, and they have not been rejected on account of the things they've said. So people have not been shocked, but have taken seriously their accounts of the exploitation they're experiencing or other difficulties that they are encountering in their lives. Not all young people experience participation in the same way, and one of the interesting issues that emerges from the literature is that young people's participation in services changes over time, that at times they may wish to play a more active role in the design of services and in influencing policy. At other times they will wish to withdraw from that. At times they will not want to be identified as a CSE service user. And there are important questions and issues to be discussed in terms of non-participation, what that means, how that's understood, how the views of young people who maybe don't want to be part of a participation group, how these are understood, how they can influence practice as well. And so to that extent, participation will cover a spectrum of activities, and within the literature that's certainly true, that thinking about participation ranges from individual practice and ways of working to ensure young people's views are being taken into account in decision making, to much more formal activities and ways in which young people are involved in working with services, contributing to policy decisions, perhaps working in the area of training or presenting, and other ways of influencing the way in which CSE is understood and services provided. But overall, we find in the literature a lack of evidence about what participation really means in practice in CSE services. That doesn't mean it's not happening, but the evidence isn't always written down or recorded, and there is a lack both of description and evaluation of participation in practice. That's not unique to CSE services, but it is something that CSE services might want to consider as they embed their approaches to participation. So research evidence doesn't capture or reflect the often very rich practice that's taking place, and that says something about the research and practice relationship. Unfortunately, research tends to lag behind a little bit. Similarly, participation is evident in existing practice models. So you may be aware of ideas around therapeutic outreach, or a strengths-based model, or the 4E's as model as offered by Bernardo's services. But the actual term participation and what it might mean is not always explicit. This may not be a problem if we go back to the wide range of definitions in the previous slide, but it is perhaps something to reflect on or consider. In that respect, it's a bit hard to say how far participation is replicable if we don't know a huge amount about what it means in practice, and it's therefore difficult to say how it might be transferred. But there does seem to be something about that value that's placed on young people's views and experiences, and the fact that services are considering this. And we hope that the Alexei project more broadly will provide new evidence about how participation links to different models of CSE services. But we do know in very broad terms that these are the kinds of different participative activities young people may be involved in. So meetings, training, which has been a big part of the work of CSE services over recent years, taking part in research and evaluation as consultants or advisors or researchers, often involvement in creative activities to provide resources, materials relating to CSE that can help influence thinking. Young people have been present at local and national level in policy development, expressing their views, letting people know what they want from CSE policy, and in groups which may serve a therapeutic function as well as providing opportunities to influence services and also provide young people with new skills and opportunities. When we look at the theory behind all of that underpins it, we find that there are some distinct strands of thinking here, which again may affect how we think about participation in practice, and may provide us with a stronger underpinning about why we do what we do. And within the literature that formed part of this review, there were three issues, three strands of thinking that seemed particularly important. The first and perhaps most obvious of these is around children's rights, and the establishment of these within international and national law, that children are moral and legal subjects who have a legal right to be consulted, to be involved, to be taken, to be recognised as individuals who bear these rights, and have alongside these rights to protection and rights to other services like education and health. And these wider set of rights need to be considered in the context of CSE services as much as alongside their rights to protection. Secondly is the strand of thinking around agency and structure and power. And this emerges from what's often termed the new sociology of childhood, that children, rather than as being viewed as less developed, less competent, less able to act, are recognised as individuals in their own right, as active subjects whose behaviour affects the world around them and who are also affected by that wider world. And to that, within that, we also find thinking about the power relationships experienced by children and young people, both children and young people generally by virtue of their age, but also the particular inequalities experienced by those who are members of more marginalised groups, whether by virtue of being in care, a particular minority ethnic group, and so on. And thirdly, there is a developing strand of thinking around the issue of vulnerability, what this means in terms of the balance between protection and participation. How far do we emphasise protection at the expense of participation, or is the argument rather that through listening to and enabling young people to participate, we actually protect young people, that their involvement in services, their active engagement in positive relationships within services helps protect them from child sexual exploitation. But if that's going to happen, it's clear that it can't happen for individuals alone. And participation is clearly within the literature conditional on structural arrangements being in place that make that possible. That's not to say that individual workers can't effect change, but that it is very difficult if they are not supported by wider organisational arrangements. And that begins with a commitment to a participatory approach at all levels of an organisation. Only through that will the time, resources, and recognition of the need for inclusivity of different groups be made possible. It's only through that workers themselves will be empowered to give the time and resource that they need to build up relationships with young people that in turn provide opportunities for participation. And as part of that, involvement in individual decision making. It will also mean things like creating an environment that feels friendly, warm and approachable to young people, that is accessible in terms of time and the availability of staff. And staff are crucial to this process, and young people emphasise this where in the evidence that's available. Where staff have skills and knowledge, that is really important to their understanding of how CSE happens and indeed of the broader needs of young people. At the same time, young people emphasise the need for warmth, friendliness and compassion, and personalities that make it possible for them to connect and build relationships. However, it's clear from the literature that participation is not going to mean one thing at one time. It will change, and it will change within organisations as different young people enter and leave services. And to that extent, a flexible and creative approach to what participation means will be necessary. So, to conclude, it's clear that there's a strong commitment to the idea of participative practice in CSE policy. But we perhaps need to give more time, more thought to making explicit how participation is happening, and to identify ways in which this is affecting practice. That doesn't mean bureaucratic exercises. It is about thinking what is meaningful about participation, and perhaps sharing that more widely than has previously been the case. There is no doubt in the literature that young people who are represented there value the way in which CSE services recognise them as individuals, listen, take their views seriously, and provide that warmth and friendly approach. At the same time, we need to know more about those who aren't represented in the literature, and for services to think about how inclusive their approach to participation actually is. Participation in CSE services is distinctive, though it shares characteristics with other services working with young people who face many adversities, such as young people in the youth justice system, young people in the care system, young people with mental health difficulties. There are challenges, there are risks, there are difficulties in holding young people and responding in a way that's effective. And to that extent, having a strong knowledge base about CSE and the different ways in which it might manifest itself is important. But that individual practice needs to be matched by organisational commitment. And in all of this, more evidence is important, more research can be important if it is done well and used effectively. And to this extent, it would be good to see more examples of the practice that takes place within CSE services and how participation is embedded within this. So participation is not a static idea, it's something that is ever-changing, that is fluid, and perhaps is not easily captured within the constraints of a literature review. If the process of participation is to be a fruitful and empowering one, then services will need to work with service users in an ongoing cycle of research, reflection, and action.